This is my insulin video. So to start out, I'm going to do my 6 rights of medication, the right patient, right medication, right dose, right route, right time, and right documentation. So he's ordered to get 10 units of sliding scale insulin, and then because his blood sugar was was 230, and then he's supposed to get 16 of the intermediate insulin. So I'm going to wash my hands, and I'll get my alcohol swab, and I have the intermediate and the regular insulin. And I would roll this in my hands, make sure it's mixed, and I would make sure that if I opened it, there's the right expiration, a date, and a time when I opened it, both of them. So I'm going to wipe the top of these, and we're going to use a U100 insulin needle. So it's going to be 26 units total. So I'm going to draw it up full of air to 26. And then I'll inject air into the intermediate first, making sure I don't touch any of the medication. So I would go to 10. And then I'll put the rest of the air into the insulin. And then I'll withdraw 10 units. And you can go past because it's making sure there's no air bubbles. Okay. Then when I withdraw out of the intermediate, I have to make sure I stop right at 26. And I'll recap my needle. And I'd have another nurse verify that this is the right amount. And it says 26 units, so she verified. And I would take my medication and everything with me to the patient's room. I would have him identify himself with 2 identifiers, so his name's Skip Rocker, his date of birth 1/1/1972. I'd explain what I'm doing. I'm giving him his 26 units of insulin, 16 of intermediate. And I'd wash my hands, put my gloves on. I'll clean the area with alcohol wipe. Then I would pinch, I'll take my needle off. I'll pinch the skin, and I'll go at a 90-degree angle. Or a 45-degree angle, sorry. Go in, inject the insulin. Then you have to wait a few seconds and pull out. And recap my needle in that method. Put it in the sharps container, and then I would dab the area. Blot. And I'd throw that away, take my gloves off, wash my hands, ask him how he tolerated it. Then I would document the amount of insulin given, to which patient, the time I gave it, how he tolerated it, and that's all.